Every 3 minutes, someone in America walks into a pharmacy to pick up a prescription that their doctor promised would help them. But here's what nobody tells them at that counter. The pill they're about to take home might be the reason they forget their grandchild's name 6 months from now. I'm Dr. Joseph Miller, and I've spent 18 years watching this exact story play out in exam rooms across this country. Sharp, independent people who suddenly can't remember where they parked, who lose the thread mid-sentence, who start getting called forgetful by family members who have no idea what's really happening. And in case after case, it wasn't age, it wasn't genetics, it was sitting right there in the pill organizer on their kitchen counter. Today, I'm counting down the 9 most common medications directly linked to memory loss and cognitive decline. From the ones hiding in plain sight to the one at number 1 that's probably affecting someone you love right now, whether they know it or not. Stick with me to number 3. It's prescribed to millions for something that sounds completely harmless, and new research shows it may be shrinking your brain's memory center by the month. Before we dive in, do me one favor. Drop a comment right now telling me how many prescription medications you take daily. I read every single one, and it helps me understand what this audience actually needs to hear. Let's start the countdown. Number 9 is sitting in nearly every bathroom cabinet in America, and most people think it's completely harmless because you don't even need a prescription for it. I'm talking about Diphenhydramine, the active ingredient in Benadryl, Tylenol PM, Advil PM, and dozens of over-the-counter sleep aids. People take it to fall asleep, to stop a runny nose, to calm an allergic reaction. It costs $3 at the drugstore, and because it's on an open shelf, most assume it's gentle. Here's what's actually happening inside your brain. Diphenhydramine belongs to a class of drugs called anticholinergics. Big word, simple meaning. They block a brain chemical called acetylcholine. And acetylcholine is the messenger molecule your brain uses to form new memories and stay mentally sharp. As we age, our brains naturally produce less acetylcholine. So when you take a drug that blocks the little bit you have left, the impact hits far harder at 65 than it does at 25. The area that suffers most is called the hippocampus, a small seahorse-shaped region deep in your brain where short-term memories get encoded before being stored long-term. Block acetylcholine there, and new memories simply don't stick. I've had patients take Benadryl every single night for years, and slowly, quietly, they started losing their edge. They'd forget appointments, misplace their keys 5 times a day, struggle to follow a conversation, and nobody, not once, connected it to the little pink pill on their nightstand. Here's the research that should change how you think about this drug. A 2023 study published in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly. Their risk of developing dementia was 54% higher compared to those who avoided these medications entirely. That's more than half again the normal risk, from something most people treat like candy. So here's what to do. Check every label on anything marked PM, nighttime, or sleep aid. Most of them are just Benadryl wearing a different name. If you take it for allergies, switch to a newer antihistamine like loratadine, Claritin, or cetirizine, Zyrtec. They don't cross into the brain the way Benadryl does, and they're far safer for long-term use. If you take it for sleep, we'll talk about better options in a minute. And please, never stop a medication suddenly without talking to your doctor. But stop assuming over-the-counter means safe for your memory. That's number 9. Number 8 is one your stomach might love, but your brain is quietly paying the price. I'm talking about proton pump inhibitors, or PPIs. The big names are omeprazole, Prilosec, and esomeprazole, Nexium. These drugs shut down acid production in your stomach, and they're handed out like candy for heartburn, acid reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they try to stop, the symptoms come roaring back. So it feels like the drug is the only thing keeping them functional. Here's the part almost nobody hears at the pharmacy counter. Your stomach needs acid to absorb certain critical nutrients. Chief among them is vitamin B12, which protects the insulation around your nerve cells and keeps your brain firing cleanly. Turn the acid down long enough and your B12 quietly drops. So do magnesium and calcium, two minerals your neurons depend on to communicate. Starve your brain of those nutrients and you get confusion, brain fog, and memory lapses that look exactly like early Alzheimer's, when the real culprit is a deficiency your medication has been causing all along. In 2016, a massive study in JAMA Neurology examined over 73,000 people aged 75 and older. Those who took PPIs regularly had a 44% higher risk of dementia than people who didn't use them. And here's the deeper concern. PPIs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. Here's the move. If you've been taking a PPI every single day for months or years, have a conversation with your doctor about tapering down to a gentler option like famotidine, Pepcid, an H2 blocker that doesn't carry the same cognitive risk. Natural options like DGL licorice, deglycyrrhizinated licorice, can coat and calm the stomach lining without touching your brain at all. The goal isn't to stay on a pill forever out of habit. It's the lowest dose for the shortest time. Medication number 7, Oxybutynin, bladder control. Number 7 is prescribed for a problem most people would rather not talk about, but we need to talk about it because this one is dangerous. I'm talking about Oxybutynin, sold as Ditropan. It's given to seniors dealing with overactive bladder, that sudden, urgent need to get to a bathroom that can reshape your entire day. The relief is real. The embarrassment it spares people is real. But here's what Oxybutynin does. It works by blocking acetylcholine, the exact same memory chemical we talked about with Benadryl. And this drug crosses into the brain very, very easily, parking itself right in the regions where memories are made. That makes it one of the most dangerous anticholinergic drugs on this list, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their dementia risk was 49% higher, nearly 1 in 2. Here's what troubles me most. Almost none of them were warned. They were told a pill would calm their bladder. Nobody mentioned it might dim their mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their train of thought, misplacing things constantly, and everyone just nods and says, "Well, you're getting older." It's rarely traced back to the prescription until real cognitive ground has already been lost. If you take oxybutynin and you've noticed memory slipping, take that seriously. You don't have to choose between your bladder and your brain. Newer medications like mirabegron work through a completely different pathway and don't block acetylcholine at all. For most older adults, they provide the same control with far less cognitive risk. Bring it up at your next appointment. Number 6 might surprise you because it's one of the most prescribed drugs on the planet. I'm talking about statins, specifically simvastatin, Zocor, and atorvastatin, Lipitor. Statins lower cholesterol and reduce the risk of heart attacks and strokes. They belong in many people's treatment plans, and this is not a blanket case against them. But here's the half of the story that usually gets left out. Cholesterol does more than affect your heart. Your brain is nearly 60% fat, and it uses cholesterol to build myelin, the insulation wrapped around every nerve fiber so signals can travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you may be starving the brain of a raw material it actually needs. The statins that cause the most trouble are the ones that cross easily into brain tissue, the lipophilic statins like atorvastatin and simvastatin. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline. Some patients described frightening blanks, a name they've known for 30 years, gone. A conversation they just had, erased. A route they've driven 1,000 times, suddenly unfamiliar. Here's the important nuance. Not every statin affects the brain the same way. Pravastatin, Pravachol, and rosuvastatin, Crestor, don't cross into brain tissue as readily, and they're generally considered safer for cognition. So, if you've been on a statin for years and you're noticing fog, forgetfulness, or confusion creeping in, that's a real conversation to have with your doctor about switching to a brain-safer option or adjusting the dose. Never stop a statin on your own. It may be protecting your heart. Just get the plan right, with help. Quick pause. If this is connecting dots for you, do me a favor and tap that like button. It genuinely helps us reach more people who need to hear it. And while you're down there, tell me, how many prescriptions are you taking right now? I read every comment. All right, back to the countdown. Number 5 is a class of drugs among the most prescribed in America for anxiety and sleep. I'm talking about benzodiazepines, lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. They work by boosting GABA, the brain's natural calming signal. At first they feel like a rescue. The panic stops, the racing thoughts quiet down, sleep finally comes. Over time, the picture changes. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years. Those who used benzodiazepines for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer-acting ones, like diazepam, were worse because they linger in the body and build up in fatty tissue, including the brain. What the drug is doing is a slow chemical sedation of the entire brain. It learns new things more slowly. It grows less flexible. And many people describe a flatness, a sense of not quite being themselves anymore. Here's the cruelest part, the exit. Stop a benzodiazepine abruptly, and the anxiety and insomnia come back twice as hard, along with agitation that can be genuinely dangerous, which makes the pill feel essential right when it's doing the most harm. So here's the rule, and it matters. If you've been on a benzodiazepine for more than a few weeks, do not stop suddenly. That can be life-threatening. Work with a doctor to taper slowly over weeks or months. Gentler options exist. Buspirone for anxiety, which doesn't sedate or cloud the mind, and cognitive behavioral therapy for insomnia, CBTI, which brings the calm back without the cognitive cost. Number 4 is a single pill prescribed for 3 different problems, and it carries one of the heaviest cognitive burdens of all. I'm talking about Amitriptyline, sold as Elavil. It's an older antidepressant still handed out today for nerve pain, for sleep, even to prevent migraines. That versatility is exactly why it spreads so quietly. It looks like a do-everything pill. Underneath, it's one of the most powerful anticholinergic drugs still in wide use. It blocks acetylcholine so strongly that with long-term use, memory problems stop being a rare side effect and become the expected result. In 2015, a large study in JAMA Internal Medicine followed over 3,400 adults aged 65 and up. Those with the highest cumulative dose of anticholinergic drugs like amitriptyline over 10 years had a 54% greater chance of dementia. And almost none of them were ever told the pill could do that. They got it for sleep or pain, then slowly noticed words going missing, memory thinning, concentration fraying, and chalked it up to age. It doesn't even take a high dose. A small nightly dose, taken for years, can quietly erode brain power with no obvious red flag until the damage is done. If you or someone you love takes amitriptyline, that's a conversation worth having soon. For nerve pain, options like duloxetine, Cymbalta, or gabapentin can give similar relief without the same anticholinergic weight. For sleep, melatonin or a very low dose of doxepin, which is far gentler, can take its place. And for mood, newer antidepressants like sertraline, Zoloft, or escitalopram, Lexapro, are considered much safer for long-term brain health. Number 3 is the one I told you to watch for, because it's handed out to millions for something that sounds harmless. I'm talking about paroxetine, sold as Paxil. It's one of the most prescribed SSRIs, used for depression and anxiety. On the surface, it looks like the modern, gentle option. Here's the detail they rarely mention. Paroxetine is the one SSRI with strong anticholinergic activity. That single fact sets it apart from its siblings like sertraline and escitalopram. In 2021, a large review in Frontiers in Psychiatry looked at older adults on different SSRIs. Paroxetine users showed measurable drops in short-term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. There's a hard irony in that. The drug is given to steady the mind, and over time, it can wear down the very clarity it was meant to protect. The fix here is clear. In older adults, paroxetine is one to avoid. The American Geriatric Society placed it on the Beers list, a formal catalog of drugs considered risky for seniors. If you take it, ask your doctor about switching to a safer SSRI like sertraline or escitalopram, which don't carry the same cognitive risk. Number 2 disturbs me the most because so many people taking these drugs never agreed to take an antipsychotic. The names are quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa. They were built and approved for severe psychiatric illness, schizophrenia, bipolar disorder. Today they're handed out off-label to older adults for sleep, for mild restlessness, for the agitation that can come with dementia itself. Powerful drugs meant for severe illness, now used in homes and nursing facilities on seniors who are simply confused or hard for a busy staff to manage. The cost is steep. In 2022, a study in the Lancet Healthy Longevity followed over 25,000 older adults. Those given antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within a year, even with no history of dementia before starting. These drugs also raise the risk of stroke, sudden cardiac death, and the heavy sedation that leads to falls and hospitalizations. They work by suppressing dopamine, a chemical tied not only to mood, but to focus, planning, and memory. Drop dopamine far enough, and the brain goes slow and unresponsive, which is why people on these drugs can seem dull, flat, almost absent, while their families grieve someone who's still sitting right in front of them. If you or a loved one is on one of these, the first move is to ask the prescribing doctor a direct question. Why was this started? Is it truly necessary, or is it here for convenience? Most behavioral symptoms can be eased without a drug at all, through steady routines, less overstimulation, treating hidden pain, and fixing sleep. When medication really is needed, the lowest dose for the shortest time keeps the harm down. You are probably waiting for one final villain, one worst pill. The real worst case is something subtler and far more common. Number one is anticholinergic polypharmacy. It's the danger almost nobody names, and it may be the largest cause of drug-induced memory loss in older adults. Polypharmacy simply means taking many medications at once. Anticholinergic burden is the combined weight of all of them blocking acetylcholine together. Picture a very common situation. A senior takes Benadryl every night to sleep, Oxybutynin daily for the bladder, and Amitriptyline for nerve pain. On its own, each one might cause only a small dip. Taken together, they compound, and the total burden on the brain climbs fast. In 2022, a study in Age and Aging tracked over 280,000 older adults. Those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double, and the great majority had no idea they were on anticholinergic drugs at all. When you block acetylcholine from several directions at once, the brain doesn't just idle. Neurons start to wither, connections shrink, and the brain settles into a quiet, underpowered state that looks almost identical to Alzheimer's on testing. Here's the hopeful part, and it's the reason I made this video. Drug-induced decline is often reversible when caught early. Lift the burden, and many people get their clarity, their energy, and their memory back within weeks or months. The brain is more resilient than we give it credit for, but only if you take away what's hurting it. The fix doesn't take a miracle. It takes a careful medication review. Sit down with your doctor or pharmacist this week. Have them go through every prescription, every over-the-counter pill, every supplement, and add up the anticholinergic load. There are simple scoring tools that do exactly that. Once the problem drugs are spotted, you can taper off what you don't need, switch to safer options, and give your brain room to recover. This is the most preventable threat to the aging mind on this entire list, and that's exactly why it sits at number one. Now I want to hear from you. Of these 9, which ones are in your cabinet right now? Have you noticed brain fog or forgetfulness creep in after starting something new? Tell me below, and tell me you'll ask for a medication review this week. Your answer might save the next person who reads it. And before you go, there's one more place your body hides its warnings. Your medicine cabinet is one. Your fingernails are another. Your nails can flag trouble in your kidneys, your blood, even your nervous system, years before anything else does. And most people never know what to look for. That's the next video. I'll show you the 4 nail signs worth checking tonight. I'm Dr. Joseph Miller. Stay sharp, and I'll see you in the next one.